Hi there, it's Justin Lubino with Senior Advisors. This is our seventh weekly session we're doing on Facebook Live for Medicare questions and answers. The first part of these sessions, we generally start out with a brief topic to discuss for anywhere from 3 to 5 minutes, and then we leave it open for some questions and answers, either related to the topic we're discussing this week, or it could be any Medicare-related topic that you have a question about. You can type it right in the comment window, and we will answer the questions during the live session. So this week's topic is what is the Medicare Cobra trap, and more specifically, how can you avoid getting into the Medicare Cobra trap? So last week we discussed the Medicare secondary payer rules, which basically said as long as you work for a company that has more than 20 employees and you're working past the age of 65, you can continue to stay on that group health plan without signing up for Medicare, because the group health plan will still pay your claims. Again, as long as the company is more than 20 employees. However, there's a situation that comes up if you're working past the age of 65 and you leave work, whether you're laid off or just retire, and the company has to offer, by federal law, they have to offer you what's called Cobra coverage. And Cobra coverage is essentially the same health insurance you had with the group health plan, but you have to pay basically the full premium. Sometimes there's a 2% administration fee that's added on as well. So it could be up to 102% of the full premium for that group health plan that you would have to pay for if you choose to sign up for the Cobra coverage. What isn't always clearly explained, and I had a situation just 2 weeks ago where someone called me up and they were stuck into this Cobra trap, but the HR department doesn't always explain that if you're past the age of 65 and you want to sign up for Cobra, you have to sign up for Part A and Part B of Medicare, because Medicare becomes primary coverage. So the first issue that arises if you do not sign up for Medicare and you enroll in Cobra coverage after 65 is that your Cobra coverage does not have to pay your claims, because Medicare is supposed to be the primary insurer in that situation. There was an article or actually a lawsuit where a Home Depot employee filed a suit against Home Depot after they left employment after age 65, and they did not sign up for Part A and B of Medicare, and they enrolled in the Cobra coverage. And this case just closed in March of this year. There's an article on our blog if you want to read further about the case. But the bottom line is Home Depot won the case. And the individual who did not sign up for Medicare A and B had a bunch of claims. He had multiple sclerosis, so a bunch of claims and treatment that was not paid for by the Cobra insurance because he did not sign up for Part A and B of Medicare. So that's the first big issue if you, as part of the Cobra trap, if you don't sign up for A and B of Medicare and you enroll in the Cobra coverage. The second big issue, as I mentioned, Cobra coverage can be up to 18 months that you can take the Cobra health insurance. And if you leave employment, you only get what's called an 8-month special enrollment period to sign up for your Medicare Part B coverage. So if you take the full 18 months of Cobra and you decide at that point that you want to sign up for your Medicare Part B, and you go down to Social Security office and try to sign up, they're going to basically say, come back between January 1st and March 31st during our general enrollment period, which is basically for people that have missed their Part B enrollment. And your effective date is going to be July of the following year. So it could be worst case scenario if your Cobra runs out in April, you'd have up to 15 months with no medical coverage. There's no individual health plan that you can buy if you're past the age of 65 and you're Medicare eligible. You can't buy an ACA or healthcare.gov individual plan. So you're basically stuck if you take Cobra coverage and don't sign up for your Part A and B. You're stuck for anywhere from 7 months to 15 months of no medical coverage with no option to buy health insurance. There's nowhere you can get it. So These are the reasons that this is called the Cobra trap. The first one, again, is that Cobra is not primary insurance for the folks that are Medicare eligible, so you have to have Part A and B of Medicare. And the second issue, if you don't sign up for A and B and you take Cobra for the 18 months, you won't be able to sign up for Part B because you'll be outside of your 8-month special enrollment period. So this is a major issue. Believe it or not, we see about, 6 to 10 cases a year for people that are stuck in this situation, and there's really nothing you can do. If you're lucky, you can beg the Social Security office to see if they'll make an exception and work with you on your Part B effective date, but very rarely does that even work. So we've had folks go to their congressman or congresswoman to try and get this overturned and get their Part B into effect, but that doesn't work very often either. So we try to just educate and communicate this out there. Also on the Medicare Advisory Board for the National Association of Health Underwriters, and this is one of the key issues we've been trying to get resolved. We have a bill that's been drafted with bipartisan support. It's HR 5104 is the bill number, and essentially it's intended to fix the enrollment window for folks that take Cobra, so they can still enroll in their Part B coverage after their Cobra runs out without any penalties or delays. I didn't mention the penalty earlier, but for the folks that have missed this Part B enrollment window, in addition to not being able to get health insurance for anywhere from 7 to 15 months, they also get a 10% penalty on their Part B premiums for not having Part B for when they're supposed to have it. So it's a major issue, and we hope that if you're in that situation, you're looking to potentially leave employment, or you're being offered Cobra coverage, at least you're aware that you have to sign up for Part A and B, or if you have friends and family that are going to be leaving their employment, make sure they sign up for their A and B of Medicare. And in most cases, the Cobra coverage doesn't even make sense after you've already signed up for Part A and B. Medicare supplement in a Part D plan almost always is going to be more cost effective for those individuals than taking the Cobra coverage. So that's just a little bit of an overview on the Medicare Cobra trap, how you can avoid it and what are some of the impacts of it. I'm going to do a quick trivia question since we didn't do one at the beginning of today's session. And obviously, you can ask any questions related to the Cobra trap or any Medicare-related questions. Just type them into the window here, and we'll answer them during this live session. While we're waiting for any questions to come in, our trivia question for today, and the first one to answer it in the window correctly, I will win a $10 gift card to either Amazon or Starbucks. The question for today is, what size company is Medicare still primary coverage for an active employee? So there's a threshold for whether the Medicare secondary payer rules, which we discussed last week's video, there's a threshold where, based upon the company size that you work for, your spouse works for, Medicare is still primary coverage, which means you need to have Part A and B of Medicare. And if it's more than that many employees, then the group health plan is primary coverage. So what is that threshold? What a number of employee threshold for Medicare to be primary versus the group health plan to be primary for that active employee? And the first one and looks like Richard or Clem has the right answer in. So it's 20 employees is the correct answer. So if you work for a company less than 20 employees, then Medicare is primary. So you have to have Medicare A and B. And if you work for a company that's more than 20, the group health plan is primary. So you do not have to have Part A and B of Medicare if it's more than 20 employees. So Clem is the winner this week. So we'll be in touch on that gift card for you, Clem. And next week, just to touch on next week's topic, we're going to discuss is the Part D, which is the drug coverage. For those of you that have heard of the donut hole, it's also called the Part D coverage gap. So we're going to explain how the Part D donut hole works, and the catastrophic coverage as well, which is the last phase of Part D. We'll get into that next week during our weekly Q&A session. So I'm going to give it a couple minutes here to see if anybody has any questions for today. And we'll answer them during the video here. All right, Richard's question, is the Cobra situation the same if you get coverage through a package from your employer if you are released when you are 65? So the answer to that is yes, the situation is the same. And this is pretty common, actually, where someone gets and actually the situation I had from 2 weeks ago wasn't exactly that situation. It was an executive at a large company in New York City, and he was 67 years old and let go of the firm with a severance package. And part of the severance package is the company was going to pay for a portion of his Cobra premiums, or maybe all of his Cobra premiums, for a period of time. And so he was under the assumption that he did not have to sign up for Part A and B of Medicare. He found out when he went to sign up just a few weeks ago that he still is impacted, and yes, he still falls into the Cobra trap. And he was in a really bad situation because his Cobra was running out in is either July or August. So he's going to be without medical coverage for almost a full year. So he'd have to get, he wouldn't be able to sign up for Part B of coverage until January of 19, and it wouldn't be effective until July of 19. So yes, even if the company is offering a severance and they're paying for your Cobra premiums, it's irrelevant. You still have to enroll in your A and B of Medicare in order for Medicare, because Medicare is going to be primary, and also in order for you to get enrolled within that 8-month special enrollment period. So. Okay, so Richard, is there any reason to take the employer coverage under that situation? Does the coverage act like Medigap or what? So, and this is similar to what we normally recommend if an employer is offering a package where they're going to pay the Cobra premium. We normally recommend the employee goes back and basically just asks for the cash, or even half the, or 60% of the cash value of those Cobra premiums, because in almost all cases, the individual is going to pay, the employer is going to pay a lot more in Cobra premiums than the individual would have to go pay to get a Medigap and a Part D plan. So if the Cobra premiums are, let's say $800 a month, the individual might be able to get a supplement and a drug plan for $300 a month. And therefore, we recommend they go back to the employer, and instead of getting them to pay the Cobra for whatever period of time, negotiate some sort of cash value that's less than the Cobra premium, but still covers the Medigap and Part D coverage for the employee. And that's generally going to work. It's a win-win situation for the employee and the employer. The employee gets better health insurance. The employer gets a lower premium, and everyone's happy. So that's generally what we recommend in that case, Richard. Kim asked a question. I'm currently on sick leave from my place of employment on Cobra and applying for disability. I will be eligible for Medicare in November. Can I just stop my Cobra? Okay, so in Kim's question, just to kind of help educate everyone, if you're on Social Security disability for 24 months, you become automatically eligible for Medicare. So you will be automatically enrolled in A and B Medicare after the 24 months of Social Security disability, even if you're not 65 yet. And then your question is, do I need to keep Cobra coverage or not? So this is another situation where the Cobra coverage is now going to become secondary to Medicare for you, Kim. And for what you're probably paying in Cobra premium, it probably doesn't make sense. You're probably not getting that value out of a secondary insurance policy once Medicare becomes effective. My recommendation in that situation is to instead get a Medicare supplement again and a drug plan, which would probably cut your premiums more than in half each month for what you're paying for the Cobra versus what you pay for the supplement and drug plan. And it's probably going to be better medical coverage as well with the Medicare supplement and a Part D plan. So the bottom line is, no, you don't have to keep the Cobra after you get your Medicare, but you should have something to cover that 20% Medicare is not going to cover. And the Cobra is probably not cost effective to do that versus a Medigap and a Part D plan. So I hope that helps answer your question, Kim. Claudia's question is, if you retire in March and have Medicare Part A and B and took the company paid Cobra until September, when do you need to sign up for a supplement and a Part D plan? Okay, so if you retire in March, and I'm assuming you're past the age of 65, you started your A and B in March, took company paid Cobra until September 30th. When do you need to sign up for a supplement and Part D plan? Okay, so technically you have a 6-month Medigap open enrollment period that starts when your Part B is effective. So if your I'm assuming based upon your question, your Part B is effective March 1st, you would essentially have until a September 1st effective date to enroll in a Medicare supplement with no medical questions. You can get any Medicare supplement you want with no medical questions asked in that 6-month period after your Part B effective date. So that is the time we would generally recommend in your situation to sign up for that supplement, just so you can avoid the medical underwriting that's required after the 6-month period to get into a Medicare supplement. So I would normally say you'd want to line it up again with the end of that Medigap open enrollment period in your situation. Now, if we had spoken before you retired, before March, we would have recommended you go back to the employer again and try and negotiate some sort of different deal where they give you that money for the Cobra premium or a portion of it for the Cobra premium that you could use towards a supplement and a drug plan and save money for them and get you better medical coverage for that period between March and September. But given where we are at this point, my recommendation would probably be September 1st so you can avoid the medical underwriting. All right. Hope that helped answer your questions, Claudia, Richard, and Kim. We'll give it another minute here if there's any other, see if there's any other questions out there. All right. It looks like that might be it for our questions for today. So I'm going to wrap up today's session. And again, next week we'll be on at the same time, 10:30 Eastern time. And next week's topic is we're going to discuss the Part D drug coverage and specifically the Medicare donut hole. There is a pretty big change coming next year to the Medicare donut hole from a bill that was passed in February of this year. It's a positive change for the consumer, for the beneficiary, to get better coverage for Part D of Medicare and hopefully reduce your out-of-pocket exposure with Part D of Medicare. So we're going to discuss that further in next week's session. So I look forward to seeing you all next week as well at the same time. So hope everyone has a great week. Take care.